Manipal Health has made an offer to Fortis Healthcare, which is the second largest hospital chain, and they put out in the statement today saying that the board is still evaluating. So how could the deal be structured and the possible scenarios? Just remember, this is a scenario analysis, not necessarily what will happen, but we try to do a scenario analysis and what it means for Fortis Healthcare's minority shareholders. Yatin.
Neeraj, for the benefit of our viewers, we'll just take through the news reports. Now, if you look at news reports, including that of Bloomberg, it's very clear that, there is a high chance of a preferential allotment which can happen to the tune of 4,000 crores. Of course, there are various scenarios to this as well. But, bulk of the funds that Fortis is looking to raise would be going into buying assets of RHT, which is a Singapore-based holder of Fortis assets. So, RHT is one trust wherein Fortis wants to buy it back, and that entity would be combining for a higher profitability moving forward. Now let's understand the transaction. The reports are suggesting that TPG Capital partnering with Manipal Healthcare or Manipal Hospitals will be infusing capital into Fortis Healthcare. Now it can happen in two ways, is what the news reports are suggesting. Scenario one is basically a plain vanilla capital infusion or a preferential allotment by Manipal as well as TPG via equity. Of course, if it's a plain transaction, it will surely trigger an open offer because there will be management change, substantial amount of equity, because we are talking about 4,000 crores. The current market capitalization of Fortis is a little over 7,000 crores. So a higher capital infusion would mean open offer. Scenario two is basically capital infusion via debt, equity, and a proposal of reverse demerger through a NCLT process. Now, what happens in the NCLT process typically, that there is a very high chance that the court might exempt you from giving an open offer. This is something which happened in Sun Pharma as well as Ranbaxy when both of these entities merged. We had an open offer exemption because it was through a court-driven process. So, two scenarios, one with an open offer, one without an open offer. And Neeraj, now comes the final entity, which is much more interesting.
How could it look? How could the final structure look like?
If you look at the scenarios, of course, the final outcome is that Manipal, since it has a substantial interest in Fortis after the proposed transaction, they would like to house the hospital and healthcare business in one entity. So basically, this will be Manipal, Fortis, along with RST assets. That will be one entity. There is another entity, Fortis Malhar, which is listed on the stock exchanges. Now, there is already a scheme of arrangement wherein Fortis wants to demerge its hospital assets as well as the diagnostics business. So Malhar puts their hospital business into the main entity, and the remainder diagnostic business moves into SRL, which is basically proposed to get listed separately. So finally, we'll have two structures or two entities remaining. One would be the hospital chain, which is basically housing RST assets, Fortis assets as well as Manipal's hospitals, and other entity would be SRL, wherein the diagnostics business would be put in. Of course, what Fortis has informed the stock exchanges that they have received unsolicited, non-binding bid or expression of interest from Manipal Group, and the board has not yet decided on Manipal's offer. However, the Times of India report says that there will be a board meeting today for Manipal as well as Fortis, which will probably approve such a scheme, which will be entailing fund infusion and a possibility of a merger and a scheme of arrangement.